The rise of anti-aging cosmetics that promise drug-like results, firmer skin, wrinkle reversal, DNA repair, collagen regeneration, and more, has blurred the boundary between dermatology and consumer marketing in deeply problematic ways. These products, often containing ingredients like peptides, antioxidants, or retinoids, are marketed with bold claims that mimic pharmaceutical interventions, yet they are not subjected to the same regulatory scrutiny as drugs. The result is a wildly profitable industry that leverages scientific-sounding language and selective data to sell hope in a bottle, without the burden of proof. This trend reflects a calculated strategy. Position cosmetic products just close enough to medicine to imply effectiveness, but stay just far enough to avoid the FDA's rigorous requirements for safety, efficacy, and advertising accuracy. By law, cosmetics in most jurisdictions, including the US, cannot claim to treat or alter the structure or function of the body. That would classify them as drugs, triggering costly and time-consuming clinical trials. But the industry has mastered the art of skating right up to this legal line. Instead of saying, "This cream treats wrinkles," the label might read, "Helps reduce the appearance of fine lines." Rather than claiming to restore collagen, it might suggest it supports natural collagen production. These are not minor semantic games. They are carefully engineered workarounds that allow brands to make potent-sounding promises while remaining in the cosmetic category. In practice, many consumers interpret these claims as evidence of true biological action, and that's exactly what the marketers want. The profits speak volumes. Anti-aging cosmetics are part of a booming global beauty industry worth over $60 billion annually, with products routinely priced at hundreds of dollars for tiny jars. Luxury skincare lines like La Mer, Estée Lauder's Re-Nutriv, and L'Oréal's Age Perfect rake in enormous sums by appealing to fear and aspiration, the fear of aging and the aspiration to stay youthful. Even drugstore brands now have dermatologist-developed anti-aging lines that play on the authority of science without being held to scientific standards. Peptides, for example, are small chains of amino acids that may, in theory, signal cells to produce more collagen or reduce inflammation. But in topical cosmetics, the evidence for their efficacy is weak, often relying on in vitro studies or manufacturer-sponsored trials with vague or subjective endpoints. These studies rarely undergo peer review, are not published in reputable journals, and almost never disclose long-term effects. Retinoids, derivatives of vitamin A, do have real dermatological effects, but true retinoids like tretinoin are regulated as prescription drugs. The over-the-counter versions, like retinol or retinaldehyde, are often too weak, unstable, or poorly formulated to provide the results that consumers expect. Still, brands continue to use scientific jargon, bioavailable delivery systems, epigenetic repair enzymes, cellular rejuvenation, to convey a sense of technological sophistication. These phrases are not necessarily false, but they are often untestable or exaggerated, designed more to impress than to inform. The result is a sophisticated illusion. Products that feel like medicine, cost like medicine, and promise results like medicine, yet are legally and biologically nothing of the sort. Even the packaging mimics pharmaceuticals. Clinical-looking fonts, sterile white boxes, and references to dermatological labs are visual cues intended to trigger trust. In some cases, the products are co-branded with research institutes or celebrity doctors to further enhance their credibility. The message is clear. This isn't just skincare, it's science. But the science is often tenuous. Many cosmetic companies conduct internal studies that show marginal improvement in skin hydration or texture, then spin those results into sweeping marketing claims. For example, a 12-week in-house study on 20 women might show a 5% reduction in wrinkle depth as measured by imaging software. That becomes clinically proven to reduce wrinkles. Yet no one explains that these effects are minor, temporary, or irrelevant outside of tightly controlled lab conditions. Meanwhile, the lack of oversight creates a loophole for global exploitation. In countries with even weaker regulations than the US, products may contain unlisted ingredients, harmful preservatives, or biologically active compounds at unsafe concentrations. The promise of youth in a jar becomes not just misleading, but potentially dangerous. The deeper harm, though, is psychological and societal. These products reinforce ageism by pathologizing normal aging. Wrinkles, sagging, and skin texture are treated as flaws to be corrected rather than natural developments of a human life. The marketing doesn't just sell creams, it sells shame. It tells people, especially women, that aging is unacceptable, unattractive, and reversible if they buy the right serum. And that message has proven wildly profitable. It has created a beauty pharma hybrid market where consumer vulnerability is monetized under the guise of empowerment, where language is legally vague but emotionally manipulative, where the fantasy of eternal youth is sold with just enough scientific dressing to sound legitimate, but never enough evidence to be accountable. In sum, the anti-aging cosmetic industry has built a financial empire by exploiting the gray zone between medicine and marketing. It avoids the burdens of proof while reaping the rewards of perceived credibility. And in doing so, it distorts science, misleads consumers, and perpetuates harmful ideals, all under the shimmering promise of youthful skin.